Hey everyone, myself Dr. Amit Patle. I am JR in the Department of Radio Diagnosis at AIIMS Hyderabad. Today we will going to discuss about the normal X-ray of the shoulder joint. So here we have the AP view of shoulder joint, and there are three main components of the shoulder radiographs, and which are the bones itself, the joints, and the soft tissue. The bone of the shoulder joints include proximal humerus. Look over here. This is the proximal humerus, lateral clavicle, the ribs, and scapula. The scapula is in turn divided into the glenoid, coracoid, and acromion. Okay, here we have acromion. The articulation of this bone comprises of four major joints, and specially glenohumeral joint, acromioclavicular joint, sternoclavicular joint, and scapulothoracic joint. Now look over here. This is the head of humerus. This is the anatomical neck. Here we have the greater tubercle. This is lesser tubercle, and in between them there is intertubercular groove. Just below it there is surgical neck. Right now this is the glenoid fossa, and here we have the coracoid process. Right, this is the first rib. Here we have superior angle of scapula, and if we make out, this is the superior angle, and here we have the inferior angle of scapula. This is the lateral border of scapula. This one is the medial border of scapula, and here we have the sternoclavicular joint that we discussed before. Right, now we have two major views in the shoulder joint. The first one I just told, that is the AP view, and this is the AP view here, while this one is the lateral view, or it is also called as the Y-shaped view. Now in this is the coracoid process, this is glenoid, and this is the humeral head. So this is all this is the basic information about the shoulder joint. So the next one is elbow joint. Although it's a non-weight bearing joint, but yes, it is the important joint in our human body. The elbow is synovial hinge joint made up of articulations, mainly the distal humerus and the proximal ulna. Okay, however, articulations exist between the proximal radius and the humerus, as well as the proximal radius and ulna. The three articulations are referred to as ulnohumeral joint, right, radiohumeral joint, and proximal radioulnar joint. Okay, now many of the muscles of both the upper and the lower arm either cross or attach to the least one compartment of the elbow joint, and making it no surprise that after the shoulder joint, elbow joint is the second most commonly injured joint in sport related injury. So yes, let's talk about this. So I just said this is the humerus. Here we have the medial epicondyle, while this one is the lateral epicondyle. Right, this is the olecranon. This is the trochlear head of humerus. Here we can see the trochlear head of humerus here, and in lateral view here we have the trochlear head of humerus, while this is the coronoid process, this is the tuberosity of radius, and this is the ulnar bone. Don't confuse here, this one is the radius, while this is the ulnar bone. This is neck of the radius, right? And look over here in lateral view, this is the radial fossa. Okay, and this is the neck of radius here. Now this is about the normal anatomy of elbow. So here I provided you a X-ray of pelvis, and here you can see that there are multiple numbers are given to the specific site. So you can pause this video and try to write the number which is given to the specific site. Okay, or I will tell you about the numbers I have shown to you, and few numbers you will have to find them what is the answer. So let's talk about it. So here we can see that the first number is given to the iliac crest, right? Number second is ilium, right? This one, that is the third one, you find it out. Now this is the fourth one, and we know that this is the sacroiliac joint. Yeah, and this is the fifth one, which is very important for the localizing site in clinically, that is on clinical perspective, that is the anterior superior iliac spine, and just below it, that is the sixth number, which is anterior inferior iliac spine. Okay, now this is the seventh number, and try to find it out what is it. Now look over here, this is the eighth number, and this is superior ramus of pubis, while the ninth number is obturator foramen. Okay, just below it, it is ischial tuberosity, that is the 11th number. 12th number, it is very important, try to find it out if you don't know. Then the 13th number is sacrum, right? And just above it, we can see that there is one spinous process, and this one is the, yes, fifth lumbar vertebra. Now 14th is, which is very easy, that is femur. Just above it, that is 15th, and this is the lesser trochanter, while this one is the greater trochanter. And the line between the greater and the lesser trochanter, which is called as, yes, intertrochanteric crest. This is the intertrochanteric crest. And the 17th number is femoral neck, and just above it, that is the 18th number, which is, yes, 17th number is, yes, femoral neck, while just above it, yes, this is the femoral 8. And the 19th number, you try to find it out, or should I tell you? Yes, so the 19th number is acetabulum. Okay, so this is the normal anatomy of the pelvis. So pelvic and hip x-rays are the most frequently obtained when there is a concern about fracture, joint dislocation and effusion. Okay, so this is very important to know about the normal anatomy of the pelvis, right? Now let's talk about the next x-ray, that is the x-ray LS spine. And here we have the lateral view of the x-ray LS spine. So look over here, here we have the S1, that is the sacral bone, right? This is the L5, and above it is L4, L3, L2 and L1, and just above L1 there is T12, right? So this is the vertebral body. Here we have the pedicle, right? And this is the superior vertebral notch, while just below it, it is the inferior vertebral notch. And in this, here we have the intervertebral foramen, right? This is the spinous processes, and this one is the intervertebral disc, right? Now I know that you heard the term, that is spondylosis. So what is spondylosis? So spondy means spine, while losis means problem, right? So lumbar spondylosis, it is a degenerative spinal disorder, and it describes as all degenerative conditions affecting the disc, vertebral bodies and associated joints of the lumbar vertebra. So more than 85% of the people over age 16 are affected by lumbar spondylosis. So that's the different thing. But yes, what is spondylolysis and what is spondylolisthesis? So look over here, this is the pars interocularis, and we know that pars interocularis is the weakest portion of the vertebra, and because of this, in spondylolysis there is stress fracture develops through the pars interocularis. Okay, so look over here, here we have the stress fracture, that's called as spondylolysis, while in spondylolisthesis, the fractured pars interocularis separates and allowing the injured vertebra to shift or slip forward on the vertebra directly below it. So look over here, this is the L5, right? And just below it is L4. So L4 is slipped on L5. Okay, so this is the spondylolisthesis, right guys? So let's talk about some examples. So here we can see that this is the stress fracture, right? So this is called as, yes, spondylolysis, while look over here, here we can see that L5 slipped over S1. So here we have the spondylolisthesis. So this is all about the normal anatomy. We will talk about the normal anatomy of the knees in the topic of osteoarthritis. Thank you.